Alzheimer's Disease by Ashley, Bonnie, Anarie, Gabby, Joanna, and Ben. What is Alzheimer's disease? This is a condition that affects the brain permanently as it progresses. This indicates the disease gets worse over time. It affects short and long-term memory. An individual with this condition may forget immediately of what a person asked or said, or over a period of time an individual will forget where something that is commonly used every day is located. This can be an example of your toothbrush. That's usually in a bathroom. Alzheimer's originates in the hippocampus and entorhinal cortex. These are areas of the brain involving learning, memory, navigation, and perception of time. These are an important key factor with Alzheimer's. Abnormal proteins surround and build up against healthy brain cells, which makes scientists to believe the cause of Alzheimer's disease. On the pictures shown on the right, you can see the images of the brain as normal, healthy, a mild cognitive impairment with Alzheimer's, and lastly, the last one shows Alzheimer's disease as it progressed. You can see it affects the brain and gets worse over time. The second picture on the bottom is showing dying neuron with tangles and plaque. This is affecting the brain and causing the disease to worsen.
The history of Alzheimer's. History of Alzheimer's starts in the late 1890s when August Dieter came into the care of a Dr. Alois Alzheimer. She is complained by her husband with much memory loss and behavioral changes, and especially came about in the night. Dr. Alois Alzheimer interviews August Dieter for about a year, and she passes away only 5 years later as her condition worsened. Her brain is studied then by Dr. Alzheimer when she dies at the young age of 55, relatively young, and finds that plaques and tangles are within a large pocket in her brain. It was found that there were amyloid pockets in the year 1984 and tau tangles in the year 1991, and both these have a correlation with cognitive decline and the progression of the disease. Now, we know that Alzheimer's is a rare form of dementia, and research is still being precluded and still conducted with no cure in sight. But there's much hope for a cure one day.
Signs and symptoms for Alzheimer's disease is that people may experience behavioral changes such as aggression and agitation. They experience mood swings such as anger and general discontent. They experience depression, hallucination, and paranoia. They experience loss of appetite, and then they have cognitive problems, which technically means that they have trouble understanding and thinking and remembering things.
How the nervous system controls muscle movement. In the brain, neurons will get injured and die, and this causes neurons to decrease and break down as the disease worsens. This usually occurs when an individual is on its last few stages. This is called atrophy. This then causes the brain regions to shrink. The brain will then have significant volume loss. Since an individual has Alzheimer's disease, it may make it more difficult to exercise and join in on everyday activities. Muscle strength and body movement will become decreased, and this causes loss of muscle mass in the upper and lower extremities. This is important if an individual doesn't partake in walking or exercising at least once a day. This can cause neurogenic atrophy. This is a nerve issue that is due to an individual having Alzheimer's disease. The nervous system and muscular system go hand in hand with one another. A loss of cholinergic neurons within the brain that produce acetylcholine, which is a neurotransmitter, can be dangerous if the function isn't working right, and it is involved in a signal transduction, learning disability, and memory.
Focus for the connection between Alzheimer's disease and the central and peripheral nervous systems. I will start by explaining what the central nervous system is, and then go to the peripheral, then the Alzheimer's disease and their connection. The central nervous system is part of the nervous system consisting primarily of the brain and spinal cord. It acts as the body's control center, processing sensory information and directing responses. It coordinates voluntary activities like movement and involuntary ones like breathing and heartbeat. The peripheral nervous system is the connection between the central nervous system to the rest of the body. It consists of nerves and ganglia that transmit signals between the CNS, other organs like limbs, and the skin. It is divided into sensory and motor divisions, which carry information to and from the central nervous system. It is essential for movement, sensation, and autonomic processes. This shows that the peripheral nervous system is centered around the CNS. It is linked to the central nervous system. The central nervous system is in the brain and the spinal cord, and then the peripheral system goes from the spinal cord to other parts of the body. Alzheimer's disease is a neurodegenerative disorder which begins with mild memory deficits and modest neuronal death, followed by progressive extensive neuronal death, eventually leading to another severe memory loss disease, which is severe dementia. It is frequently accompanied by other neurological and personality impairments, including slow movements, hampered motor coordination, general confusion, and personality change. Personality change, movements, slow movements, and motor coordination. These are peripheral nervous system activities, and the memory deficits are central nervous system activities. The nerves in the limbic system, responsible for memory, emotions, and associating behavior with emotions, are affected. This is how the central nervous system is affected. The nerves in the limbic system, which is in the brain, are affected. The frontal lobe, which is responsible for planning and organizing actions and regulating the person's judgment and behavior. The hippocampus and temporal lobes, which are responsible for verbal and visual memory, are also affected. The parietal lobes and occipital lobes are also affected. Alzheimer's disease disrupts communication among neurons, resulting in loss of function and cell death. In aging, the brain loses neurons in lower numbers, but in Alzheimer's, many neurons stop functioning, lose connection with other neurons, and die. It disrupts processes vital for neurons and their networks, including communication, metabolism, and repair. As I've said before, like the frontal lobe, the parietal lobe, the temporal lobes are affected, which are responsible for communication, for metabolism, and repairs. Alzheimer's disease typically starts by destroying the neuron and the connections in parts of the brain involved in memory. It then moves to areas in the cerebral cortex, responsible for language, reasoning, and social behavior. It eventually affects other areas of the brain, and the person with Alzheimer's disease gradually loses the ability to live and function independently. This picture here on the slide, it shows a healthy neuron, a healthy brain, and a neuron with Alzheimer's in the brain with Alzheimer's disease. As you can see on the diseased neuron, the neuron is infected, it is disrupted, it is damaged. And as for the Alzheimer's disease brain, it has shrunken. As compared to the healthy brain, the hippocampus has shrunk as well. The ventricles are enlarged. They are abnormally large. Just like I have said before, Alzheimer's disease eats away the brain. It shrinks the brain and damages the neurons in the brains. Neurons related to brain function and other organs.
Alzheimer's disease is a neurodegenerative disorder that is characterized by the accumulation of abnormal proteins, namely beta-amyloid plaques and tau tangles in the brain. These said proteins disrupt neurocommunication in the brain, and this leads to inflammation and soon contributes to cellular dysfunction. Neural damage and death along these imbalances result in cognitive decline and memory loss. The disease involves genetic, environmental factors. Ongoing research aims to understand and address these cellular and physiological aspects for effective treatment in the future.
Sensory information. An individual with Alzheimer's disease may experience 1. Visual perception. Individuals with Alzheimer's disease may experience difficulties with depth perception, contrast sensitivity, and visual processing. This can result in problems with recognizing objects, faces, or judging distance. 2. Auditorial perception. Some individuals with Alzheimer's may have difficulty processing and understanding auditory information. They may struggle to follow conversations or become more sensitive to loud noises. 3. Olfactory perception. Changes in the sense of smell can occur in Alzheimer's disease. Some individuals may have difficulty identifying or recognizing different odors. Tactile perception. Sensory changes in touch perception can lead to alterations in sensitivity to temperature, pain, or pressure. Individuals may have difficulty interpreting or responding to tactile stimuli. Although Alzheimer's disease doesn't have a cure for it, there are many medications and drugs that the FDA approved. So for people that struggle with memory and thinking, they're given anti-amyloids, which works by attaching and removing beta-amyloid, which is a protein that turns into plaque. So basically what this does is it helps the person be able to do things on their own, and it helps them reduce their cognitive. For the patients that struggle with insomnia, they're given Solvarance, which is used by helping block the chemical messenger that's involved in the sleep-wake cycle. And then for the patients that deal with depression, they're given antidepressants so it could help with their low mood and irritability. And some examples of those would be paroxetine and citalopram. And then for the people that deal with behavioral changes, they're given anxiolytics. And some examples of that would be lorazepam and oxazepam. And then for the people that have the symptoms of hallucination and delusion, they're given antipsychotic medications, but the FDA has warned people about this type of medication because it could cause a risk of stroke and a death in older patients with Alzheimer's.
Diagnosis. On average, people with Alzheimer's live about 4 to 8 years after diagnosed, but can live as long as 20 years depending on other factors. Life expectancy is less if a person is diagnosed in their 80s or 90s. Nearly 500,000 new cases of Alzheimer's disease are diagnosed. About 1 in 9 people aged 65 plus has Alzheimer's, and the percentage is 10.7. Alzheimer's disease is twice as common in women compared to men, and 1 in 3 seniors die with Alzheimer's. The lifetime risk of the Alzheimer's at age 45 is 1 in 5 for women and 1 in 10 for men.